Hi, my name is Michael Gordon. I'm here to tell you about EMDR, which is a revolutionary form of psychotherapy that works at the physiological level to help us with any disturbance that we're experiencing in our life. EMDR is an abbreviation for eye movement desensitization and reprocessing. Now that's quite a mouthful. Let me break that down for you. But first let me explain the theoretical background and the clinical approach of EMDR. EMDR is essentially taking advantage of the naturally occurring mechanism that we all are familiar with as the fight-or-flight response. The limbic brain, which is the midbrain region, contains the organs that help us mediate our experience in the world and assess threat and look at experience in a way that manages our interactions with the world and keeps us safe. If we're presented with a threat that's overwhelming, that limbic system, which works in conjunction with our neocortex, that's the prefrontal cortex in your conscious mind, if it's working correctly, will resolve those experiences in the moment very quickly and helps adapt to the experience and say, I need to do this, I need to do that, keep myself safe, etc. But if we are overwhelmed, then the limbic system can take over, and it reduces blood flow to this part of our brain, which helps us rationally stay calm and make executive decisions, which may not be appropriate if you're running from a predator or you need to respond to an emergency. Unfortunately, when that response occurs in a traumatic episode, it can leave us with unresolved or unprocessed trauma in our mind and nervous system body. Now, this naturally is something that gets processed in the deepest stage of sleep, which we know as the REM cycle, or rapid eye movement. And essentially what happens is that your metabolism slows down so much that the activity in your brain can go offline in terms of negotiating any in-the-moment activity that it needs to do to get through your day. And it actually slows your metabolism down to the point where there's actually a kind of paralysis in your muscles, and that's because your system is now going to go so deeply into relaxation that you go into dream state. Very, very sub-processing routine in the deepest stage of your sleep architecture, in delta stage sleep and further into REM cycle. And so essentially your body goes completely relaxed and your muscles are paralyzed so that you don't act out your dreams. And sometimes people experience this as sleep paralysis or sleepwalking, which is a whole other topic. But what is happening there by design and by evolution in our brain anatomy and our nervous system is that in that deepest stage of REM sleep, and you see people sleeping with their eyes closed, and their eyes are darting very quickly across the orbits of your eye sockets. And what's happening there is that the eye movement is linked to cross-hemispheric activity in your brain. Left, right hemisphere of your brain are talking across the center part of your brain, which is called the corpus callosum, and they are integrated with cross-talking to resolve those very, very disparate strands of our experience and senses that occur during the day or from past experience. So what EMDR was designed for and developed for is post-traumatic stress disorder. By definition, that experience some kind of major trauma where we never get to resolve that experience in that natural way, in a relaxed state when we were sleeping. So you wake up and feel refreshed, and your subconscious mind and nervous system have flushed out that body memory. You can see this very much in animals with the fight-or-flight response or nervous response. Animals will shiver and shake. It's a way of trying to displace the nervous energy and the fear in their bodies, literally in the energy of their muscles, and trying to shake off that excess energy and the adrenaline, etc. So what EMDR is able to do is, in the safe context of a clinical setting, is to identify in the current disturbance that a person is experiencing, phobia, generalized anxiety, aversion in relationships, avoidant behavior, addiction, etc., that there's some disturbance that your system is still being triggered into and doing its natural job to try and defend against this perceived external threat or this internal stimulus that's still coming up. The classic case of that is, say, the combat veteran who hears a backfire from a car and runs for cover because their nervous system is responding as if they are being shot at by a sniper, or there's mortar fire, or etc. So EMDR allows us to pinpoint those unresolved traumas in our background that re-triggering our system into that somewhat irrational response, really, or not fully adapted response, and to clear out those disturbances. The eye movement allows, in the presence of that original threat, allows your brain to calmly process it, just like it would during sleep. So when you're sleeping, your mind knows that you're asleep. You're not actually under threat. No matter how terrifying the dream is, your system is relaxed to the point that your body's immobilized, and your mind can resolve the disturbance, and your nervous system can clear that energy out, and those old neurochemical states that go with it, the heightened arousal, etc., can now calm down or down-regulate. So when you wake up in the morning, you say, strange dream, and you carry on with your day. You're able to function and communicate with other people and not feel overly responding or under-responding to situations. And though EMDR was developed specifically to treat major trauma and post-traumatic stress disorder, you can see how it relates to all kinds of other conditions or blocks, if you will, or issues in the lives of people who seek treatment. If you go back earlier into childhood, not only are you more easily overwhelmed, but any adaptations that you may develop in that moment can be very irrational because you've got a child's mind. So we go very, very far back to identify these kind of overwhelm experiences, and it bypasses a lot of the psychodialogue that you have in talk therapy, which requires the patient or the client to really develop emotional awareness and to have the skill to understand these things. If they could do that, they wouldn't need therapy. So there's a brief introduction to what EMDR is. It's a very short-term therapy. It was built upon other very sound therapeutic practices, namely cognitive behavioral therapy, but it does work at the physiological level to reduce and desensitize and change any habituated trauma and allow the person to come back to a calm mind-body state and re-engage their life in the present. And if there may be current conditions that are similar to things they've faced in the past, an abusive childhood or whatever, then they can now take the steps to correct that and change that as an adult with a full functioning mind-body state. So I encourage you to come and visit the website, and it's listed below, mindfulyoutherapy.com. I do offer sessions via Skype, video conferencing, and of course if you are in the Vancouver, Greater Vancouver area, in the Lower Mainland of British Columbia, here in beautiful Canada, then you can contact me and I'm happy to provide a consultation for you, either in person or over the phone. But I have worked very successfully with Skype sessions, and because this is a client-directed or a client-enabled healing process, it really is stimulating your system to resolve in its own natural way with a bit of assistance from the clinician. Well, thanks very much for listening. There'll be more videos looking at how we can take the EMDR approach and my particular adaptation of EMDR, which I call the heart system, you'll find on my website. And I take a very holistic approach that involves a nutritional support and social and dietary and etc. And we'll address specific issues and how EMDR and my heart system can and have been very successful in resolving issues like smoking or phobias or intimacy, relational issues, etc. Take care, and we'll see you next time.